hello, welcome. Welcome to Demo Day. I'm Keith Kama. I'm the Managing Director of the Techstars Healthcare Accelerator powered by Permanente Medicine Mid-Atlantic States. And it's great to have you with us here live in DC. And thanks to all of you joining from the live stream down in the back of the room. We got a camera on. We got hundreds of people out there watching us on live stream, including a lot of mentors who've been involved in the program remotely. Thank you for joining us. As you probably already know, this program is focused on visionary entrepreneurs who are meaningfully transforming healthcare delivery by making it more accessible, efficient, and personalized. And they come, 10 companies in the program come from 5 different countries, and they're working on a very wide range of different types of solutions. But what they all have in common, as you'll see, is that these companies can be transformative and have a very significant impact on all of us as they succeed and scale. And so in a little bit, you'll be hearing 3-minute pitches from the CEOs of each of the 10 companies who've been with us for the last 3 months, working around the clock to advance their companies. We'll do that in 2 groups of 5, a little break in the middle to show you a little behind the scenes. But before we jump into that, I want to give a little background on both Techstars and Permanente Medicine for those of you who might be new to either organization. And I'll start with Techstars. And at Techstars, we're inspired by the belief that entrepreneurs can change the world. And that's because entrepreneurs are the crazy ones. They're the overachievers who answer a call, then they're sitting here among us, who answer a calling to make a difference by fixing something they think is broken or building something they think the world needs. And the impact of a successful startup can be absolutely enormous for all of us, especially when we consider the types of challenges we're addressing in a program like this. But starting a company is hard and risky, and they work long hours for very little pay, am I right? And they have to make progress very quickly on very limited resources right from the beginning, time's against them, and there are ultimately many more ways to fail than succeed. And so with that in mind, Techstars started as an experiment in Boulder, Colorado nearly 20 years ago with the simple idea that even though every startup is different, they do have some common challenges that they all face. And so the experiment was to get 10 really interesting startups with great founding teams together for 3 months and support them in a few ways. A little bit of capital, a structured program, and most importantly, a group of about 100 mentors, a combination of subject matter experts and former entrepreneurs and investors who've been through the startup journey before and learned a lot of lessons the hard way by making mistakes. And the test was to see whether we could help these 10 companies chart a faster, better, more likely path to success by avoiding some of the more common mistakes we all made along the way in our own journeys. Needless to say, that experiment worked out, and that modest pilot in Boulder is now repeated a couple dozen times a year all around the world. 4,900 companies have been through a Techstars Accelerator. They've gone on to raise $30 billion in venture funding. They have an aggregate market cap now of $127 billion, and there have been hundreds of exits along the way, including 22 of them worth over $1 billion each, so-called unicorn status. And we love those last few stats because what they say is not only do we love the companies, but third-party investors are voting with their wallets to say they think the companies are pretty special as well. And so today we'll be adding 10 new companies to the 4,900 number, and in the weeks, months, years ahead, with your help, we'll be adding to the stats down below that as well. Before I ask Dr. McCarthy out to say a little bit more about Permanente Medicine, a few thank yous are in order because a program like this takes an awful lot of work to put together. So first of all, I want to thank our incredible program liaison from Permanente Medicine, Jessica Locke. Jessica, where are you? In the back. Wave. For everything you've done to make the program happen and work with me day to day, every day for, I can't remember how long we've been doing this, but it's been amazing. And Jessica will be up at the midway point. And to my incredible program team at Techstars, Mary Grace Guyana over there in the control tower, and Mason Gunter. Mason, where are you? Mason in that corner. Thank you for making this happen. You'll be hearing from Jessica and Mason at the midway point. And next, to our 100+ mentors and speakers who've been involved in this program, many of you are here working day to day with the founders has been extraordinary and has really advanced. And that, again, is the secret sauce of what Techstars is all about. So thanks for what you've done to support them as well. Jessica and Mason will be up at the midway point to more properly thank you for your efforts and show a little behind the scenes video. And finally, to the entire team at Permanente Medicine Mid-Atlantic States, first at many levels, first for your leadership in addressing the challenges in healthcare broadly, next specifically for your incredible collaboration on this program, and then to the entire executive team and the dozens upon dozens of physicians, many of whom are here with us today, who've rolled up their sleeves and worked side by side with us on this at every stage, back from the couple hundred top applicants coming in, reviewing those, interviewing the top 40 companies and panels to see who should progress based on the medical opportunity that they addressed, and then working with us over the last 3 months, rolling up your sleeves and supporting the companies. I have never seen anything like it at Techstars. It's been a true pleasure working with you all every day, and it is a true honor to welcome to the stage the Executive Medical Director of Permanente Medicine Mid-Atlantic States, Dr. Richard McCarthy.
Thank you. I just want to thank Keith and Techstars. This has been a great partnership. Wildly exceeded my expectations for what was possible. As you probably know, KP is known for innovation because we're prepaid. We never have to stop someone from doing something because we can't bill for it. So we have a lot of opportunity. And Dr. Michael Stone and Jessica Locke run our innovations engine internally. And we really focus on solutions from folks doing the work. We were the founders of virtual urgent care for KP, and we cover half the country. We have lots of internal innovation, and the partnership with Techstars started as thinking, well, what's going on outside? And we're a big organization. We can work fast because of our size in the Mid-Atlantic, but we can't work as fast as all of you. And wouldn't it be great to be able to see innovation from the outside and see different perspective? And the partnership with Techstars has done that and more. I can tell you that for myself as a mentor and one of the leaders in the program, and for every physician in the largest multi-specialty private practice in the Mid-Atlantic, which is MAPMG, we've had the same experience, which is incredible inspiration from these 10 companies and their founders. I think I have learned as much, if not more, from them as they've learned from me in terms of the companies that I mentor personally. And I think that all of our physicians who have worked with these folks believe that. I think we all think, no, American healthcare is broken. It's too expensive. It's not accessible enough. Healthcare should not be a privilege. It should be a right. And I think all of us in healthcare want to make it a right. And I think the work that's done here to lower the cost of care, improve quality, improve accessibility, improve service experience will effectively do that. And so I couldn't be more excited about our partnership. I am so incredibly proud of the 10 companies that were chosen out of 400 companies applied for this. These are the la creme de la creme of companies, and their innovative spirit, their ability to understand us, their ability to help us understand them, and really work together to try to create something better for them and better for us has been magical. So without further ado, you're here to hear their pitches, which are pretty incredible. And I hear the first pitches were incredible. To hear the second ones, the ones today, are even better. So thank you. I am incredibly proud to be a part of this program. And I really want to thank and recognize all of the amazing entrepreneurs that we've had the opportunity to work with. Thank you.
So we didn't want you to burden you with all of them. But that brings us to demo day. And so I'll just say a couple final things to let you know what this is all about, and then we'll shift into the founders presenting. But so demo day, just for some background for those who might be here for the first time to a demo day, it's a few things, just to put it in context. It's a celebration of their successful completion of the 3-month accelerator, and it's a launch into their next phase of growth as a company. But most importantly, what it's really for is for them to be able to enlist the broader community of people who might be interested in seeing a healthcare company succeed. And so that's you. And so As they're pitching, we want you to do more than just listen in, because helping a startup succeed isn't just a spectator sport. And so we want you to try to find at least one company, maybe more than one, but at least one where you think you can be helpful by maybe referring an investor or becoming a customer or referring a pilot or referring an employee, whatever it might be, and then connect with them. A couple ways to do that. First, if you're here with us in person, join us for the reception afterwards and come chat with them. But then in addition, just in case you don't bump into them, go ahead and take out your phones and you can scan this QR code and go to a lookbook of all the companies. This is also my opportunity to say, please mute your phones so we don't interrupt the pitch with a ring. But that'll take you to a lookbook where you can get contact information for all the companies. As you're seeing something that's interesting, go ahead and just email the CEO from there, connect on LinkedIn, read a little more about them. And the difference of the couple hundred people here, plus the hundreds more who are watching the live stream, each picking one company that they can find some way to support, can meaningfully move the needle here just today. Sound good? Yeah. Sound good? All right. All right. I think I've done my job, so without further ado, let's go.
In the 21st century, human ingenuity has redefined what's possible. Precision diagnostics are revealing diseases at their earliest, most treatable stages. AI is freeing doctors to focus on patients, not paperwork. And breakthroughs once thought impossible are saving lives today. The promise of modern medicine has never been greater. But while innovation accelerates, the U.S. healthcare system itself is straining. Patients face rising costs and uneven access. Clinicians across the nation are stretched by workforce shortages and mounting pressure. Chronic conditions consume the vast majority of healthcare spending. And despite all the advances, American life expectancy is falling. We believe we can and must do better. And we believe that visionary entrepreneurs, supported by mentorship, community, and direct access to a leading provider, can help transform healthcare. Permanente Medicine Mid-Atlantic States and Techstars have jointly created a platform designed to help extraordinary founders accelerate their path to success. Permanente Medicine's value-based care model provides an ideal proving ground for startups. Integrated data, aligned incentives, and thought-leading physicians. Combined with Techstars' global network and proven accelerator model, this platform enables founders to make years of progress in months. Advancing solutions that improve outcomes, reduce costs, and elevate care. Across this inaugural class, founders are turning their vision into reality. They envision a world where mental health care is inclusive and accessible, where physical therapy is engaging and effective, and where chronic disease is individually predicted and proactively prevented. They envision a world where anyone can test their eyes with a smartphone, where cancer is diagnosed faster and more precisely through AI, and where people are seamlessly guided to the right mental health care at the right time. They envision a world where virtual operating room assistants streamline non-clinical tasks, where hospital-level care is delivered at home, where heart failure and hypertension are passively monitored and managed, and where time-consuming workflows are automated, so clinicians can focus on what matters most. In short, they envision a world they are working tirelessly to create today. The challenges are vast, but great entrepreneurs see big problems as great opportunities to make a lasting difference. Please get ready to hear from 10 extraordinary founders who are doing just that.
I am very excited to partner with Valine Health. Valine Health's clinical operating system tackles the costliest and most error-prone workflows in healthcare delivery. The company was founded by a physician and an enterprise AI leader who make a fantastic team. I believe Valine has the potential to become the operating layer of modern-day healthcare telephone workflows. Please join me in welcoming Dr. Panagiotis Kakatsos, CEO and co-founder of Valine Health.
The most expensive crisis in healthcare isn't clinical, it's operational. Every year, we spend over $1 trillion on healthcare administration, and $250 billion of that is pure waste. But what's even worse, 75% is completely preventable. But this isn't a workforce crisis, it's a workflow crisis. And no workflow costs the system more than post-discharge coordination. It's the #1 cause of all CMS penalties and a top 3 driver of both revenue leakage and operational costs. Valine turns this bottleneck into a breakthrough. Valine is the first AI-native clinical operating system built to automate the costliest and most error-prone workflows in all of healthcare, starting with post-discharge. As soon as a patient leaves the hospital, Valine takes action. It monitors recovery, flags medication errors, activates home care, escalates risk in real time, and dynamically coordinates follow-ups, making sure that every patient falls through the cracks. Every action is autonomous, every patient covered, and every loop closed. Today, this process takes over 40 manual steps per patient, 300 EHR clicks per discharge. It spans 6 departments and leaves up to 30% of tasks either missed or delayed. Valine reduces this to 1 AI agent with 0 clicks. Think of Valine as the platform that never sleeps, always on, always monitoring, always coordinating, 24/7. And best of all, it takes minutes to set up with 0 manual effort. Most healthcare automation solutions today are point solutions, 1 agent for 1 task. Now, this may work for simple linear tasks, but break when something goes off script. Valine adapts 1 platform, every workflow, no re-engineering. And that's the difference between automating a task and owning a workflow. Workflow automation is now the fastest growing segment in all of health tech. It's a $57 billion market with less than 5% market penetration. So a market this big and this early, and Valine is first to scale. And in just 9 months, Valine has reached over $1 million in annual recurring revenue. And we're seeing these numbers with 82% gross margins. And today, for the first time, we are thrilled to announce that Valine Health is going live with Kaiser Permanente Mid-Atlantic States, scaling across interventional radiology, advanced care at home, and GI. And this shows the true power of an operating system, one that scales vertically across departments and expands horizontally across the entire healthcare ecosystem. Our team is our superpower. I'm Dr. Panagiotis Kakatsos, a triple board certified physician, a repeat health tech founder with 2 prior exits. And my co-founder, Rui Wang, is a serial AI builder and operator, an original IBM Watsoner. And together, we combine deep clinical experience with enterprise AI innovation. Our vision is bold, yet simple, to become the operating layer of modern-day workflows. Today, post-discharge. Tomorrow, every broken workflow in all of healthcare. So please, join Valine in transforming healthcare's biggest bottleneck into its biggest breakthrough. Thank you.
Good afternoon. At Kaiser Permanente, we constantly look for solutions that improve care delivery while reducing the overall cost of care. TrackingMed stood out immediately. Their platform shows measurable value, fast scalability, and the ability to integrate into existing operating room workflows with minimal disruption. Their team is impressive, laser-focused, and continues to deliver rapid progress throughout the accelerator. We are proud to partner with TrackingMed and excited to see their impact on operating rooms across the U.S. It is with my great pleasure to introduce Inbar Oz, CEO of TrackingMed.
One in 8 Americans will undergo surgery each year. It can be you, your parent, your child. You don't even want to think about it. When you do, you picture it as a scene from Grey's Anatomy. Classical music, very handsome surgeon, calm and perfectly controlled operating room. But after 2 decades in medtech, I can tell you, the reality is far different. The operating room is paradoxically chaotic. $1 million technologies right beside Stone Age workflows. Nurses are still hand counting hundreds of surgical items, instruments, needles, sponges, then juggling between paper checklists, whiteboards, and endless electronic records to document it all. This is all vital for patient safety, yet time-consuming and heavily error-prone. In fact, 40% of surgery time is spent just validating counts and documentation, making sure nothing is left inside a patient. Unfortunately, in 1 of 4 surgeries, this system fails. And 1 miscount will trigger a whole cascade. Recounts, x-rays, extended anesthesia time, higher complication risk, and delays. 45 minutes per surgery are lost to these inefficiencies, costing hospitals over $3 million per operating room annually. That is a $140 billion opportunity to modernize and improve the surgical care in the United States alone. In 2026, no patient should be at risk, nor should any nurse spend time on a task machine can better do, faster and smarter. So, meet Tracky, the first surgical AI co-pilot. Tracky is a vision and a voice AI platform that runs live in the operating room. It is powered by mounted ceiling cameras, microphones, and our patented algorithms, and automatically count, track, and document every item, every action, alerting the team the moment something is missing or if incorrect. Others have tried but offer only partial solutions. Some use vision, but only after the surgery. Some use voice, but not in the OR where needed. And others can count, but only few items. TrackyMed is the only platform that does it all, acting live in the operating room as a companion to the surgical team. With the continuous usage, it will deliver 50% in OR cost reduction, adding capacity for 200 more surgeries per operating room annually. And our team is built to deliver that because we have already built, deployed, and scaled medtech and AI systems that were used by surgical teams. We proved feasibility at Sheba Medical Center, achieved 95% accuracy in real-time surgical object detection, and now, with strong and accelerating traction, we are moving forward with US pilots, starting with Kaiser Permanente Mid-Atlantic States as our strategic partner, and followed by pilots in HCA Healthcare System, Northwestern, and Innova. Thank you. Join TrackyMed in creating safer, more efficient operating room and for patient and for surgical teams. An OR you will no longer need to imagine.
Hi, I'm Dr. Fazneh Sabi, Associate Medical Director at MapMG. Connecting and navigating mental health needs is more important than ever. I've had the pleasure of working with the Mindframe team, who has been helping us tackle this important challenge with a mix of technical expertise, sensitivity to the pressures facing patients and clinicians, and a deep respect for the connection at the heart of therapy. It is with pleasure that I introduce Pinar Gorgulu, the CEO of Mindframe.
In 2015, my dad had to rush my uncle to the emergency room. My uncle was having hallucinations. For years, he had seemed uneasy and withdrawn, but this was different. Suddenly, we were faced with impossible choices. Do we go to a psychologist, a psychiatrist, or emergency care? What if we made the wrong choice? Care navigation is still broken in mental health care. Patients are left to choose their own paths and often end up in the wrong place. Capacity is wasted and risk goes unnoticed because our systems can't differentiate between discontent or danger. Billions are being spent in the US and globally to improve the status quo. But despite strong efforts, wait lists extend 3 months, and 30% of revenue leaks out through external referrals. Regulators are now charging fines for delayed access as high as $200 million in some states. We eventually did find care for my uncle, but only after years of navigating a maze of clinics, providers, and treatment programs. Something was painfully clear. In mental health, the problem isn't about rate your pain 1 to 10. It's I can't sleep. I feel numb. I might hurt myself. These signals are so deeply human that our systems are just not built to quantify them. And this is where Mindframe comes in. Our AI triage lets patients express themselves naturally. This means the clinical context that we capture routes them to the right level of care in a fraction of the time. As patients make progress through treatment, we continuously track their outcomes. The real-time clinical intelligence that we build is the future of precision mental health care, allowing health systems to maximize outcomes with optimal resources. This is a $4 billion global epidemic that nobody has truly solved yet. Sure, some systems do a good job of tackling one aspect of the puzzle, like tracking, routing, or triaging. Mindframe, however, integrates all three to drive better resource decisions, closing the loop that others fail to. As a team, we bring decades of experience building AI systems in regulated environments. From CERN to JP Morgan, we've shipped AI products in environments where trust and accuracy are critical. Today, we're working with PhD-level psychologists who have been shaping Mindframe from day one. Since October, we've been working with Permanente Medicine Mid-Atlantic States on a one-stop solution in personalized mental health and wellness. We moved from initial conversation to MVP in just under 8 weeks, with several operational and clinical champions supporting us. The goal, prove gains in access, patient experience, and care outcomes, then scale the playbook across regions and peers. With Mindframe as the intelligence layer for 30 million other patients like my uncle, the future of behavioral health will start with transparency and understanding, not luck. If you're also reimagining how patients access care, we'd love to exchange ideas. Thank you.
I have had the pleasure of working with the CIPRA AI team as they partner with our physicians to reimagine how we manage hypertension and diabetes. As a primary care physician and leader of physicians, I am thrilled that their approach brings scalability and precision to chronic care. This is something our physicians and our patients need now more than ever. It's my pleasure to introduce Dr. Sujit Day, CEO of CIPRA AI.
For several years, I struggled with hypertension. I did everything possible my doctors asked me to do, but things didn't seem to work. And uncontrolled hypertension led to coronary artery disease. I didn't give up. I partnered with Kaiser Permanente and others through my work as professor at UC San Diego to study chronic diseases deeply. What we found out is that 50% of patients with hypertension and diabetes do not have it under control. And this leads to more severe diseases and drives 90% of America's healthcare costs. Why is this happening? Chronic care disease management and effectively done needs preciseness and continuity. Tailoring the care to each person's individual physiology and individual lifestyle. But of course, health systems do not have the resources or the time or the data to provide this kind of care at scale. And so people like you and me essentially get infrequent and generic care. At Cipra.ai, we have come up with solutions to address both these problems head-on. First, for each patient enrolled in our program, we collect various sets of data live from monitors, like health monitors, wearables that you wear, and our Cipra.ai app that you download. Using all this data, we are creating a digital twin for each patient, which models very precisely the behaviors that the patient is going through and how they impact their chronic disease. Next, using the digital twin of each patient, our agentic AI platform continuously, autonomously, and yes, precisely guides you to the behavior that impacts you the most. For example, if you're a hypertension patient, instead of telling you generic advice like have low sodium diet, our AI agent will guide you, for example, to train at a specific cardio heart rate zone, which would be important for you. Our AI agents also provide real-time insights and, most importantly, predicts and prevents. We can predict a glucose spike even before it happens. We can prevent the glucose spike even before it happens by giving you small meal adjustments, which will have better time in range effect. The solutions out there are very manual intensive and thereby drive up care workload and drive up cost. Chatbot-based systems have been introduced recently, which do reduce care workload, but they do not have the benefit of digital twin precision. Now, there is a program which does digital twin precision, especially for diabetes care, but they are very manual intensive and thereby, again, very high cost. Cipra is the only solution out there which combines digital twin precision with agentic AI scalability to offer very high quality care, but at very low cost. We have proven our solutions time and again through multiple clinical trials and actual deployments. We have shown that we can reduce we can increase care outcomes by 3x, we can reduce care workload by 40x, and thereby producing an impressive 3x ROI. We are a B2B model working with our healthcare partners, like healthcare providers and health plans. We are tapping into a 200 billion plus chronic care market for rapid growth. Just in the last 1 year that we have been commercially deployed, we have been rolled out by 6 health systems. Thank you. We have assembled a world-leading team from multiple prestigious health organizations as well as technology companies to provide AI excellence, clinical expertise, as well as, importantly, startup success with multiple exits. Cipra.ai is showing that chronic disease does not have to be a life sentence. Please join us in enabling all the health systems to empower their patients to control their chronic disease, like now the happy news that I could do. Thank you. Sir.
We began working with StatPoint in 2019 here in the Mid-Atlantic region. During the COVID pandemic, they really stepped up to help us take care of our patients during a time of incredible need. Since then, they've applied the lessons we learned together to create the business they have today, which plays a crucial role in our Advanced Care at Home program. Not only do we support StatPoint's entry to this accelerator, we are proud to be their customer. Please join me in welcoming Chris Gundren, founder and CEO at StatPoint Medical.
Health insurance companies hate the cost of hospital care. And for all that expense, patients would rather be anywhere else. And to top it off, the outcomes are poor. 20% of patients end up back in the hospital within 30 days. Now, for years, the dream has been to move this care to the home. Today, experts predict that over $350 billion worth of care will move to the home in the coming decade. The problem is that the home care system is stuck in the past. They take 48 hours to arrive to your home, they bring none of the necessary supplies and equipment, and there is no doctor. Back to the hospital, rinse and repeat. I'm Chris Gundrum, CEO at StatPoint Medical, and we are building Home Care 2.0 to solve this problem. Now, in this space today, there are some partial solutions. VC-backed tech players offering software, but no care. Then, the massive ecosystem of existing home-based care providers offering bits and pieces of the necessary solution on a local basis. We've taken a different approach. Our model was born, raised, and proven inside of Kaiser Permanente's value-based care system. And we believe deeply in the concept of team first. We pay 10% more than market rates, we provide excellent benefits, and most importantly, our clinicians spend as many as 90 minutes per encounter. We take the time to build real trust with our patients so we can get to the root of their issues. Now, because this problem is so expensive, we can generate solid margins and still save our customers 50%. We have proven our care model works and that our business model works. Just 24 months after launch, we've exceeded $10 million in revenue, and we have 4 regional health systems in our pipeline. Our team has over a decade of experience in the health system at every level. We are now looking to bring this revolution in care delivery to a larger stage by serving veterans, payers, health systems, and other value-based care organizations across the country. We are building a profitable business that takes great care of our employees and dramatically reduces the overall cost of care. By proving that this is possible, we are setting a standard for others to follow.
Incredible.
Wow, what an incredible group of founders. Can we give them another round of applause? I'm Jessica Locke, Chief of Staff and Strategic Innovations at the Mid-Atlantic Permanente Medical Group, and I'm joined on stage by
Mason Gunter, an investment manager here at Techstars. Now, we want everyone to know that you can connect with our founders by scanning this QR code on the screen with your phone. We'll leave it up for a little bit.
As we heard from our founders, innovation starts with an opportunity, and sometimes even a bold idea. Over the last 13 weeks, countless mentors from Permanente Medicine and the business community have been working with these phenomenal teams to shape their product to drive value differentiation to our Kaiser Permanente patients and the broader healthcare ecosystem. So, if you're a mentor and you're in the audience or even online, we'd like to take this opportunity and ask you to stand so we can give you a round of applause. So please go ahead and stand. I see many of you.
Next, we want to acknowledge our global network partners and program speakers who invested their time and expertise to accelerate our founder's journey. Lastly, we're going to give you a behind-the-scene preview of the last 13 weeks our founders had to go through to get to this day. Enjoy.
We heard about Techstars and it came with rave reviews in terms of its potential. And the way we see it is it's a way for us to be less myopic in terms of what we're innovating and get to see what the best and the brightest outside of KP are innovating.
Having Permanente Medicine involved as a premier provider has been just an added superpower for supporting founders at every step of the way. When we went out to source companies, the combination of having Techstars' expertise as a startup accelerator combined with Permanente's strength as a provider was a real differentiating factor for this and attracted a lot of interest right from the beginning.
That was really eye-opening to me to get into this space and see really how deeply experienced some people were or how many fresh ideas other people had and how that combined together.
When the program kicks off, we start with a couple days of retreat for the founders to meet one another and bond as peers, and then we get them right to work. And we start with a series of workshops by Techstars and Permanente Medicine to get them to work on their business strategies from top to bottom, from their broad vision all the way to how they're going to execute week to week to make progress towards their next milestones.
I think when you're running the day-to-day operations of a business, it can be really easy to just be running through your checklist and not have a lot of time to think back strategically about the direction you're taking in the company. It ended up being super helpful for us to just clarify what we wanted our strategy for the next few months to be.
In week 2 and 3, we brought in over 100 super qualified mentors from all different backgrounds, former founders, functional experts, and a wide range of subject matter experts from MapMG.
I can't think of any other opportunity in my professional career where you have that density of feedback, where you're able to actually put your business in front of so many people who are all experts in what they do and actually hear what they have to say about it.
Every week when we're speaking with our lead mentors, they're always telling us something that we haven't thought of before.
As far as the experience of being a mentor, it has been inspiring, seeing the innovations, seeing the growth in the companies. I've been learning how to better listen, when to give feedback, when to ask questions.
After that, we shift into relentless execution mode, and the idea is to have the companies make progress every week. They start the week by saying what the most important thing is they're going to work on, chipping away at a milestone, what KPI they're going to move the needle on this week.
The KPI meetings have definitely instilled the next level of discipline, I would say, within our company. We've already seen that benefit us in terms of getting towards that first milestone.
Having just that raw, unfiltered advice to shape our product and shape our vision has been just instrumental in Valin's success.
The progress has been inspiring to see just how devoted they are to their project despite the inevitable blips on the screen that will come up and how creative and innovative they are in finding a solution.
Oh my gosh, Techstars changed my life. It was incredible. I was expecting a lot and it delivered 10 times more.
Being in a cohort of peers, I would say, has been super valuable for us, even though folks are coming from so many different sectors of healthcare.
Sometimes it feels very difficult and lonely when you're building your own startup. Sometimes you make mistakes and sometimes you have self-doubts. Having companies and startup founders collaborating together, sitting in one office, is really, really an assurance, like what you're going through is not alone.
It feels kind of like I have an extra 15 to 20 mentors in a way.
The investor readiness sessions have really been eye-opening.
I think it was incredible to get a chance to look behind the curtain for the first time and understand what really drives a VC.
Week by week, I really see that our confidence in closing our future round is going up and up.
Getting to do a Techstars program in collaboration with MapMG that's just full of forward-thinking leaders in their field is such a superpower for me as managing director. For the companies, getting to work with an organization like that and getting access to the physicians who are such leaders in their field just helps them find product market fit so much faster, avoiding going down dead ends and really focusing on what matters.
I can't think of any other situation where you walk in the doors with a customer and immediately have that kind of access. It's really unprecedented.
Honestly, it's been one of the greatest joys of my medical career. To be part of something new, to be part of a constructive process is really a special thing.
It's great to have opportunity to talk and to work with people who are engaged into the process and who really are excited about working with us.
We've always believed in the power of what we're doing, but we're seeing new use cases and ways in which it would be leveraged by these visionary clinicians, and that's been inspiring for us.
They've certainly added a ton to me in terms of feeding my soul, of like giving me hope for the future.
I wish for the founders to have a long-lasting positive impact on the next generation of healthcare.
My wish for the founders moving forward would be to find a way to make an impact on healthcare and make people's lives better.
I wish for them to have a great impact on the public's health moving forward.
We're improving healthcare by improving the workflow efficiency.
We are improving healthcare by making it more accessible.
By turning operating room chaos into fully autonomous ecosystem.
By democratizing access to physical rehabilitation.
By addressing loneliness as a public health problem.
By making eye care accessible to everyone.
We're improving healthcare by making every mental health care journey exceptional. And during Demo Day, we're really hoping to just showcase what's next for us and come and get people to join us on that journey.
We
Recurrent admissions for congestive heart failure is a leading cause of morbidity and mortality amongst patients. Also an unnecessary burden on the healthcare system, financially costing billions of dollars a year. UNEFRA has a unique and innovative solution to that problem. I invested in UNEFRA not only because I believe in their product, but also the team has a bold vision, rigorous process and design, and the ability to succeed. I would like to introduce Farhad, co-founder and CEO of UNEFRA.
The best day for a heart failure patient is when they leave hospital and go home to their family. Hopes are high and everyone's happy, but that's not the end. Within few weeks, 1 in 4 patients will find themselves short of breath again, rushing back to the hospital for the same reason, heart failure, and it costs $15,000 on average. There are nearly 7 million people in the US at risk of heart failure, and every year, more than 1 million are hospitalized. Problem is, half of them are readmitted within 6 months. This costs $50 billion today and is rising fast. Payers get stuck with the bill, and hospitals are penalized while patients are at risk of life. Now, how does this happen? After discharge, patients often struggle to follow medication and diet plans. With fragmented tools and low adherence, hospitals lose visibility and miss early warning signs because they rely on patient self-reporting. UNEFRA bridges that gap with a lab in bathroom. We have built a smart sensor that mounts inside the toilet and keep track of key biomarkers in urine linked to the increased risk of heart failure and share that data with the care team instantly. We have validated our technology with LabCorp standard test with better than 96% accuracy. Ultimately, UNEFRA allows for proactive intervention to prevent avoidable hospitalization, and this is with minimum efforts from the patients because guess what? Everyone has to take a pee. Now, there are invasive solutions on market like implant sensors for severe cases. For simple ones, we have weight scales, but adherence is very low and feedback is slow. Unlike other toilet sensors on the market, UNEFRA is the only clinical passive solutions for fast and accurate reading to address cardiovascular disease management, where our IP and design is focused. Our international patent is pending. We have secured 130 pre-orders from Stanford, and today I'm excited to announce that we are launching our first pilot study with Mid-Atlantic Permanente Medicine right here in Washington, D.C. I'm an ex-Apple senior hardware design engineer. Product myself and team have built are now in hands of hundreds of millions of people. My co-founder, Pedram, is a Stanford nephrologist, intensivist, and a vice chair of medicine. And Saba, our chief medical officer, is a practicing cardiologist. Backed by top advisors, we are the right team to take on this challenge and succeed. Our data as service model generates up to $1,100 per heart failure patients, representing a market opportunity up to $17 billion across heart failure and hypertension. We are starting with heart failure programs in Permanente Medicine and Stanford. We'll scale across US hospitals and then go after other applications. Now, home is the future of connected care, and we are enabling that. Join us today. Thank you.
Hello, I am Chang Kwon-jung, Professor of Pathology at South St. Mary Hospital. Pathology is evolving rapidly, and meaningful progress depends on close collaboration between academy and industry. Our partnership with Medicos reflects this collaboration, combining clinical insight with technological innovation. I am pleased to introduce Mr. Jason An, CEO of Medicos. Thank you.
With the naked eye,
we can see only obstruction on a clear night. For pathologists, they see an even greater universe, hundreds of slides, each with over 3 million cells. Not for curiosity, but to find the hidden clues that could save a life. This is everywhere cancer journey begins, where time, precision, and proper treatment selection means everything. As pathologist of Korean, as president of the Korean Pathologist Association, I've seen cancer cases rising by 36%, while specialists have declined by nearly 20% globally, leaving pathologists overwhelmed. They are the heroes, but even they are the heroes behind every life-saving decision. But even heroes need better tools. In breast cancer alone, follow-up diagnosis costs over $2 billion a year, with total treatment nearing $30 billion. A pathologist misinterpretation can reach 25%, showing how weak AI training data can lead to costly delays, misdiagnosis, and patients not getting the care they need. That's where Medicos comes in. With access to 1 million annual cancer biopsies and 250,000 expertly annotated slides. Across 10 major hospitals, we are built one of Asia's most comprehensive data set. Medicos has already generated $2 million in revenue and grant funding in 2025. Thank you. Now, Medicos is beginning US validation with Permanente Medicine Mid-Atlantic States, recognized nationwide for exceptional care, working with their diverse patient population, the research will lead to a major step toward rapid expansion in the US. Backed by over 80 years of combined experience across AI, clinical pathology, and business execution, our team unites hospital insight with startup speed to scale precision diagnosis worldwide. Medicos is expanding from diagnosis to discovery, leveraging complex bioinformation to drive the shift from today's $2 billion digital pathology market to $100 billion precision medicine frontier by 2035. We are redefining how cancer is diagnosed and rewriting how it will be treated with Medicos. Every day counts. Every clear diagnosis saves lives. Join us on this life-saving mission. Thank you.
Hi, I'm Carly Saper. I'm the founding partner of Amboy Street Ventures, and we are a VC fund investing in women's health and sexual health for all genders. Because of the tremendous ghost market in LGBTQ mental health, we have been searching this vertical for a venture scalable solution for 5 years now and found the highest conviction in All's Well from both a mission and an execution perspective. What Dawn and Connor are building is a critical new standard of care, and we proudly led their pre-seed round. With that, it's my pleasure to introduce Dawn, the CEO of All's Well.
Not quite the right slide. Cool. Members of the LGBTQ community are 10 times more likely to experience symptoms of post-traumatic stress disorder than the general population. I've spent over a decade working with organizations serving the LGBTQ community, and I've seen firsthand the loneliness and mental health crisis affecting this community. When I went to Stanford to get my MBA, I decided to look into this massive problem more deeply. There are 25 million adults in the US who identify as LGBTQ. That's nearly 1 in 10 people. Unfortunately, this community experiences significant challenges, such as higher rates of discrimination in employment, housing, and medical care. As a result, 1 in 2 transgender people avoid healthcare settings out of fear of discrimination. Despite the significant need, most therapy isn't built for LGBTQ people, and the specialized care out there that does exist typically isn't covered by insurance, much less Medicaid. As a result, the exact people who really need care just don't find it. 2 in 3 LGBTQ people needed mental health care in the last 2 years, and yet the majority never visited a clinician. Instead, these folks end up venting on a Discord server, turning to ChatGPT, or calling crisis hotlines. And all the while, their mental health acuity just increases. And that's where Allswell comes in. Patients find us online or through a referral from their clinician. They then meet with an affirming care coordinator, are matched with a therapist for one-on-one care, and then finally are placed into an Allswell group where they're able to meet weekly with other like-minded people facing similar struggles. Because we're covered by most insurance, we're actually affordable for patients. We rigorously vet and train our therapists to ensure that they're adhering to clinical models that are specifically designed for the LGBTQ+ community. And most importantly, we are focused on helping people actually get better. 83% of patients who've completed one of our programs have seen reductions in depression or anxiety. Our group format and between session activities allow us to show marked improvements and scale more effectively. Patients stay engaged, providers see clearer pathways to care, and payers are on the hook for fewer high-cost episodes. Our team brings expertise at the intersection of technology, advocacy, and clinical excellence. Connor is a seasoned startup product leader, and Dr. Mike Parent is one of the leading experts in LGBTQ mental health. We started in Maryland, where finding access to affirming care is still extremely difficult, and right off the bat, we got in network with Medicaid, United Healthcare, Care First, and Cigna. We've only been in market for a few months, and yet our patient base doubles each month. And I'm excited to announce that Allswell will be coming to DC and Virginia next quarter. As we scale, we will reach the 17 million LGBTQ adults who need mental health care. We are reaching people on the margins by partnering with payers, hospital systems, and other organizations that serve this community. Join us today to help the people who need care the most find it.
Our union's health plan serves 8,000 members who operate the trains and buses of the DC area Metro Transit system. As the leader regarding health and well-being, I've observed firsthand the physical demand of their work, particularly back pain from prolonged sitting, constant vibration, and irregular schedules. I'm beyond thrilled that we are partnering with BeneKinetic to combat this pressing issue and help our members become healthier, happier, and more productive. I'm proud to introduce Gilbert Tyan, founder and CEO of BeneKinetic.
I'm a back pain patient. After my injury, I couldn't sit, stand, or walk without excruciating pain. I was fortunate to get the help I needed, but it was still so difficult, and I felt so alone. 85% of employers rank back pain as a top employee cost driver. Did you know in the US, back pain costs $625 billion each year? Physical therapy works in the clinic, but outcomes rely on home exercise, where 70% of patients simply do not perform their exercises. This means that there are more poor recoveries, avoidable procedures, and missed days of work. Existing home solutions are better than a printout, but still rely on expensive one-on-one telehealth. This leaves patients isolated the majority of the time, so participation suffers and costs remain high. Bennett Kinetic solves patient isolation by transforming home exercise into a connected and supportive experience. We deliver virtual group physical rehabilitation led by an AI coach. With our solution, you simply put your phone down, step back 6 feet. Our virtual coach provides real-time feedback, guidance, and encouragement personal to you. Soon, groups of patients will join virtual rehabilitation classes and support each other from home. Traditional physical therapy is personal, but it's also expensive and inconvenient. Existing app-based home solutions are personal and convenient, but expensive and isolating. Group exercise is motivating, but impersonal. Only Bennett Kinetic provides automated personalization, convenience, and community through group exercise. This makes our solution lower in cost, higher in uptake, and higher in adherence. We have strong support for our mission. Today, I'm proud to announce that our pilot with TEHW goes live in Q1 of next year. Over the past 3 months, we've partnered with Permanente Medicine Mid-Atlantic States expert specialists to refine our patient experience with a pilot to follow. We're also in discussions with additional health systems to offer freedom from back pain to over 5 million people. Thank you. This alone leads to a $100 million market, springboarding us to the $18 billion low back pain market, and then the broader $66 billion US market. I'm a serial founder with a successful exit. Our team includes expert PhDs in engineering, kinematics, behavioral science, and DPTs with deep clinical experience. Come join us at Bennett Kinetic and help create a world where we overcome pain together.
I've worked closely with the Finally team as a lead mentor, and it's been great to see them in action. They're taking on a really forward-looking idea, something that could change how we check eyes in the future. It's a bold idea, but they are the team that makes you think, yeah, they can do this. It's my pleasure to introduce CEO Peter Kruszinski of Finally.
Over the last century, we have reinvented how we fly. We have revolutionized how we communicate. But one thing hasn't changed: how we test our eyes. Somehow you still sit in a chair, lenses click in front of your face, and someone asks, which is better, 1 or 2? For healthcare providers, this outdated process is a bottleneck. Patients wait weeks for basic vision tests simply because there aren't enough optometrists. Routine exams crowd clinics and keep specialists from focusing on complex care. The result? Specialists are overbooked, burnt out, while costs keep rising. And all this for tests that still rely on human judgment and inconsistent conditions. The process is slow for patients and inefficient for providers. And finally, we make eye testing as easy as unlocking your phone. You simply take a photo of each eye, our neural networks measure your refractive error. We train our models based on thousands of images taken by our optometrists, translating clinical science into everyday tools. And today's alternatives include software implementing old subjective methods and specialized hardware, which is accurate but costly. Finally, bridges that gap, delivering objective, repeatable results with nothing more than your smartphone. Each year, over $15 billion is spent globally on eye exams, with $1.5 billion in the US alone, our first target. Finally, reaches this market through B2B2C partnerships, working with healthcare providers to cut screening costs and increase capacity, and with eyewear retailers to boost prescription sales and close the e-commerce flow. All this is possible because the eyes don't lie. The structure tells the story. Our team has lived and breathed vision science for over a decade. Before founding Finally, Matt and I spent over 12 years building Poland's top eyewear brand, which we successfully exited. Now we are backed by ophthalmology and AI vision experts with proven clinical track record. And after 3 years of data collection and much trial and error, we finally made it work and filed for patent protection. Momentum is clear. We are piloting with Permanente Medicine Mid-Atlantic States. At the same time, we are deploying in Ghana, bringing vision screening to areas with limited infrastructure. And we have other major partners lined up for the next year. And we keep on refining accuracy to match clinical autorefractor standards. All this is part of our mission to bring vision care into the digital age. And our goal is simple: to make basic eye care accessible to everyone, anywhere.
Well, that's it. What do you think? How about the founders? Thank you for being a great audience, and the great job, founders, on the pitches. And my only remaining job is to invite you to come have a drink with us in the reception area and come grab something to eat and meet the founders there. For those of you on the live stream, thanks again for joining us. I hope you'll connect with them over there. Big shout out over here in the control room to the Gallaudet University tech team and to Mary Grace. Thank you in working the camera. Everything was flawless. Well done. And that's a wrap. So founders, if you would come up to the stage, we're going to get a photo op up here. Everyone else, the reception hall is down the hall, or feel free to snap a photo. But Ruby is going to take a picture. Thank you. And then we'll come join you over there. Well done. Test, test.